Hi everyone. Today we're going to talk about protecting safety and health. It's the last actual chapter in your book. Yay! And I know it's the last chapter that you have to take a quiz over, although there is Module A, which talks about managing HR globally. But you don't have to worry about a video lecturette, nor do you have to worry about a quiz. So today we're going to talk about safety and health. We're going to talk about OSHA and how it operates, what the supervisor's role in safety is, the 3 basic causes of accidents, how to prevent accidents, and discuss major health problems at work and how to remedy them. Well, the Occupational Safety and Health Act was enacted back in 1970, and it was passed to assure that working conditions were safe and healthful working conditions were there. The basic purpose is to administer the Act and to set and enforce safety and health standards, and it's also responsible for setting up legal, enforceable standards. There are all kinds of OSHA laws, but the biggest one is that you have to keep records if you have more than 11 or more employees, and there's an OSHA log that you have to keep, and the OSHA log has information on illnesses and injuries. Any illness is an abnormal condition or disorder caused by environmental factors, and it can be through inhalation, absorption, ingestion, or direct contact with toxic substances or harmful agents. And that was one of the reasons for the law that came about regarding material safety data sheets. So there's a whole lot of different injuries that have to be reported. There are what's called recordable injuries and lost time injuries. Any injury is considered to be lost time in the event that you have to go to the doctor and you are not able to return to work. If it's a recordable injury, it's an injury that requires treatment by a doctor. Not all recordable injuries, however, are those where you go to the doctor, and if the doctor just checks you out and doesn't prescribe medication, doesn't stitch you up, doesn't set a broken bone, then it's not recordable. I know, it's a little bit strange, but that's the way the law is. But when OSHA comes in, and actually Tennessee has TOSHA, the Tennessee Occupational Safety and Health Administration, and the federal government has allowed the state of Tennessee to be able to take matters into their own hands. What happens is they come in and they do inspections, and they issue citations if you are not in compliance. But how do they determine that? Well, there's one way that you can always get an OSHA inspection, and that's if an employee or someone who purports to work there, because they don't check it out, calls and says that there's major issues at your plant and that people are getting sick or people are being injured and you're not doing anything about it. So they immediately have to respond within a certain period of time. I think it's 48 to 72 hours. Or in the event of a death at a workplace, they come in within a 24-hour period of time. And during that time frame, you're not allowed to work either in that area. So there's catastrophes and fatal accidents, employee complaints. And we just finished up talking about labor unions. And in the event that you ever go through a unionization, typically you end up having an OSHA inspection because an employee calls in a complaint about a specific, some violations of OSHA laws. If it's a high hazard industry, or if your OSHA log 200 indicates that you've got a lot of recordable or lost time injuries, then they'll automatically do a full report. So there's a bunch of hazards that can happen. Most of the hazards have to do with fall protection. They also have to do with cuts, scrapes, anything that hurts people, then you get into an issue with. So you want to try to make sure that you don't have those problems. So what can OSHA do? Well, OSHA can impose penalties, and one of the companies that I worked for when hearing protection and the hearing conservation law first came about, they came in and we had a noise violation. Well, we were doing what we considered to be administration, we were trying to abate it by administration wearing hearing protection, making sure that workers weren't in the area that long. However, the law specifically said that if you had a time-weighted average of over 90 decibels, which is pretty loud, then you have to do engineering abatement. And we did not do that. So we got fined for that, even though we didn't have any injuries with employees losing their hearing. We still got fined for that because of the letter of the law. But it was a low fine, and then we had to do some engineering to get the noise levels down with some batting and some absorption materials. So it's calculated based on the gravity of the violation, and it also considers if you've been in good compliance before. So typically penalties can range from $5,000 up to $70,000 per violation if you repeat it or if it's serious. Well, what are some factors that OSHA looks at that? Well, they look at, do you have a systematic safety approach? Are you following up on employee complaints? And do you also inspect your workplace yourself? That's very important to them. So if you show them that you have in place a safety program where you're doing monthly safety training, where you follow up on employee complaints, and where you inspect yourself, or you ask for them to come in and inspect, then you're in pretty good shape. But the employer is responsible for providing a workplace free from recognized hazards, being familiar with mandated OSHA standards, and examining workplace conditions. The employee, on the other hand, has to comply with the applicable OSHA standards. They've got to follow employer safety and health rules and regulations, and they're responsible for reporting hazardous conditions. Now, in the event that employees don't do that, then the employer has to have, you have to have some sort of punishment in place, or you have to have some sort of progressive disciplinary system in place. So what causes accidents? Accidents are caused by chance occurrences, unsafe acts, and unsafe working conditions. Some of the unsafe conditions can be improperly guarded equipment, such as having open pinch points. You need to put guards on them. Unsafe storage, such as overloading. Defective equipment, such as fork trucks being operated without proper braking. Insufficient lighting. Improper ventilation. So there's a whole checklist. Housekeeping is always an issue. You got to keep the aisleways clear and free, and they've got to be non-slippery. You want to have material handling equipment such as fork trucks and other things in top condition. And that's a big area where people don't really think about it. Anything that has forklift trucks or any other kind of conveyance where you're handling and lifting overhead cranes, they can cause very severe injuries and accidents. Or metalworking, when I worked at various automotive equipment manufacturers, there were pinch points such as gears and pulleys and flywheels that we had to be cautious about. There are also working conditions that can cause accidents. Pressure to complete work or bypass safety devices, fatigue, just all sorts of things that employees, when subjected to, can be high stress. And then you can have stress in a workplace that's not in manufacturing, like nursing. Nurses have a high rate of back injuries because of the fact that they have to lift patients and move patients around. So why do employees behave in an unsafe manner? Well, number one, they're not trained properly. They could be under stress. They may develop bad work habits and nobody give them corrective feedback. And it also has to do with attitudes, personalities, and skills. My husband works for a very large manufacturer, and they've gone 1 million hours without a workplace lost time or recordable injury. and they work around a lot of equipment. What's the reason for that? They have a very strict safety program, and in the event that there's an occurrence or a near miss, they investigate it and take care of it right away. So sometimes people themselves are considered accident prone, and they can be people that don't see hazards. So you got to prevent accidents. You've got to reduce unsafe conditions and acts. You got to screen. You can use posters, safety training, incentives. I used to run a little program called Safety Sweepstakes, and for every week that we went without a recordable accident, then employees got like little bingo cards or little strip cards where they could pull the tabs or scratch off, and then there would be so many winners, and they would win safety-related things like cool safety glasses or better hearing protection or first aid safety kits to take home. So there's all sorts of things that you can do to foster a culture of safety and conduct your own safety and health inspections. I used to have monthly safety committee meetings with a variety of people from the different areas of the plant, and we would go and we would actually go through and we would do our own inspections and then report back to the manager of that area. So it was very important that we did those sort of things so that we could continue to have a good, safe working environment. You've got to have a top management commitment, and DuPont is known for their safety program. They have one called STOP, S-T-O-P, and they have done very well with that, and they actually sell that to others, and it's a safety training observation program is what they call it. And it can be very, it works very well, and I implemented it at a couple of different plants. Well, you can also have workplace exposure hazards such as chemicals on the job, alcohol abuse or smoking. There can be biohazards or there can be ergonomic hazards such as carpal tunnel, which is repetitive motion type injuries. Alcoholism and substance abuse can contribute to accidents on the job. So a lot of companies have drug-free workplace programs, and they work very well. And in the event that somebody has an accident, a lot of times they send you for a drug or alcohol assessment. And if you come back with a positive screening, then you have to go through a substance abuse program before you can come back to work. There's also job stress and burnout. Workplace noise has, as the noise levels increase, the number of injuries increase. It's an irritant. The pace of work can be your work schedule, whether you work midnight shift or whether you work first shift. So stress can have a significant increase in the number of injuries and accidents on the job. But it can also have a very bad outcome for the employees and their own health. So we want to look at the employees' health not only from an accident standpoint, but also in keeping them healthy, because then they have decreased absenteeism and they want to be there and their health care costs are less. So what can you do to reduce job stress? Well, you can have good working conditions. You can build relationships with the employees there, and you can have realistic time schedules. You can also reduce your stress, find time for relaxation, and make sure that when you're off work and not working all the time. So what can an employer do? An employer can have programs and such as the Employee Assistance Program, which gives counseling. Burnout can happen when you have a lot of people who are working a lot of hours or they're expected to do a lot, and we need to take steps to do that. So what can somebody who's experiencing burnout do? Take a vacation. Take a full week off. Look at your goals and think about having a better work-life balance. And why is your work so important to you? Being on the computer all the time can also have some health issues related to it, especially eyesight. They tell you that for every 20 to 30 minutes that you're on the computer, you should look away and do something different for 10 minutes. That doesn't happen in my case a lot, but it does make a big difference. You can reduce glare, And the newer computer monitors such as this are very good at doing that. Workplace smoking. Most places have non-smoking on any of their grounds, trying to keep people from smoking, trying to decrease the amount. A policy of not hiring smoker is legal as long as it applies to all applicants. And then there's workplace violence, which can be very harmful. And how do you keep somebody from coming in and killing their boss, or killing a coworker that they've had an argument with, or an upset spouse because of a divorce situation or a child custody situation? Well, there are certain things that you can do. You can have great external lighting. You can make certain that if your employee handles cash, that there's a policy and procedure so that there's not a lot of cash there. You can have surveillance cameras. You can increase the number of people that work, especially at night. You can have a no weapons policy, although now, our state legislature's looking at allowing teachers to have handguns on the job. Not sure that that's a good thing. If you're terminating a high-risk employee, you want to make sure that you have certain steps in place, and maybe you notify your local authorities regarding that. And what about terrorism? Mail, at one time, there was the whole thing with chemicals in the mail. You want to make sure that you check mail carefully, and in the event that you find something, that you have a good evacuation plan, and that you make sure that everybody can be accounted for. And here at the college and other places that I've worked, we've actually had fire alarms where we have to go through and we have to catch and count people. That's one of the great things about working in an area where you have to badge in, because then you have a list of everybody that's at that site. And then there's enterprise risk management, which is identifying risk and then checking to see what you would do and how you would do it, kind of coming up with a plan after you identify possible situations. So you want to have a security program just to make sure that locks are effective, because you want to safeguard the employees that work. But I've always said to my employees, as I did workplace violence training with all of the staff, people who decide to do something normally intend to kill themselves. So you're not going to keep them out. Just like the recent situation with Gabby Giffords in Arizona. Who would have thought that a young man would have done something like that? He, of course, was not in the right mind, but you're not going to keep somebody from doing something like that. So what you have to do is you have to look at things, and what I say is that we need to rely on one another. So if we know that there's somebody in our organization that's having a hard time, we need to make management aware of that, so that way that they can take the proactive steps. We don't want to be standing out on the sidewalk watching the ambulances go out of here with people being very injured, shot, dead, and saying, well, I knew there was something wrong, but I didn't want to say anything. Well, we all need to say something and get the person the assistance that they need so that we can prevent these sort of things. They can't all be prevented, but at any time that we can let somebody know so that somebody can be assessed properly by the proper people who have the degrees and the wherewithal to do a good analysis of that, the better off we all are. And it's better to have a false alarm and to have somebody have to go talk to a professional psychologist for an assessment than it is to have people critically injured or even dead. Well, safety in the workplace is very important, not only from an aspect of keeping people safe from workplace injuries, illnesses, or themselves in the case of workplace violence, but also terrorist and other issues that can happen. Hope you've enjoyed this little lecturette. Make sure you read the book, take the quiz, as always, make sure you post, and work on those papers. If you have any questions, email me inside Momentum, or give me a phone call or text me on my cell phone. Remember, I check email on Momentum every morning, and I'll get back with you within by lunchtime or so. Or if you have a real emergency, text me or email me. If you, phone me. If you phone me, please just don't hang up. Leave me a message, and I will get back in contact with you. Again, last chapter. 5 weeks goes by fast. I'll see you on Saturday, and we'll do the presentations, and I'll start reading through your papers. Thanks. See you later. Bye.